For my medical ethics final, I've decided to talk about the anti-vax debate and medical ethics. I'm going to be specifically exploring the outbreak of measles in Spartanburg, South Carolina, and the perspectives of anti-vaccine parents and how their ideas caused a butterfly effect in their community. What I want to answer through exploring this case is how are anti-vaccination parents affecting their communities and children, and how is this debate impacting people around the U.S. overall? I also want to investigate this debate in relation to the 4 principles of biomedical ethics by Beauchamp and Childress, and how we can apply these 4 principles in discussion with parents to shift anti-vaccination mindsets. This topic was interesting to me after seeing an article published March 3rd by the New York Times titled, "Parents Tried to Shield Their Children from Vaccines, Instead They Got Measles." The article described the situation in South Carolina, highlighting the outbreak in Spartanburg County. Spartanburg County was ground zero for the outbreak, specifically the Global Academy of South Carolina, which is a public charter school with roughly 600 students from kindergarten through 8th grade. The school had a vaccination rate of around 21% of students in October 2025. On October 8, 2025, South Carolina's Department of Public Health made an announcement that the Global Academy of South Carolina was one of 2 schools in Spartanburg County where measles was detected.
And in some of these towns, we see significantly low vaccination rates, and we need at least 95% within the population and the community to create that herd immunity to prevent these outbreaks. But in Spartanburg, South Carolina, some of these schools, Alex, the vaccination rate drops as low as 20%. So the latest is that these numbers are increasing. They're continuing to increase as public health officials try their hardest to get a strong grip on this outbreak.
As the outbreak continued into November, when around 12 cases were reported, mobile vaccination units were set up around Spartanburg County, pleading for those in the community to get vaccinated and get their children vaccinated to help stop the spread of measles. The first thing I focused on when doing my investigation was the parents and their opinions in Spartanburg. I looked at an article from NPR.org published March 14, 2026, where many parents in Spartanburg County voiced their opinions about vaccines, and even how their minds were changed after the outbreak in their community. One anti-vax mother, Margarita DeLuca, said that she didn't think too much about vaccines until COVID-19. She's from Greenville, South Carolina, neighboring Spartanburg. She believed that the COVID vaccines were developed too quickly and haven't been properly tested, and she was opposed to the vaccine mandates. She was unsure of vaccines, but when her son Nico was born in 2021, she got him all of his up-to-date vaccinations. When Nico was 2, he spiked a fever and had a seizure after getting his 2-year-old vaccinations. He recovered, but DeLuca was so scared for his safety and her newborn twins that she decided not to vaccinate the newborns or Nico any further. She stood by her decision during the outbreak and believed that vaccinating her children when they are a bit older will be better for their immune systems. Another parent, a father, Gene Zakharov, is one of the Spartanburg County parents who changed his mind regarding vaccinations after the measles outbreak. Zakharov is one of the parents who had religious exemptions from getting his kids vaccinated for school. In Spartanburg County, religious exemptions from vaccinations for students jumped from 950 students, which was less than 2%, in 2015 to 2016, to 5,500 students, around 10%, during the 2025 to 2026 school year. Zakharov is part of the large Slavic community drawn to Spartanburg by its conservative politics and sunshine. He says that many people from the former Soviet Union who settled here don't believe in vaccines. He also said that those who moved here from the Soviet Union have a big distrust in the government. Zakharov and his wife didn't vaccinate their 2 youngest children, but they changed their mind after their 13-year-old daughter was exposed to measles at a friend's house and had to be quarantined. In November 2025, as the outbreak was first picking up in Spartanburg and nearby parts of South Carolina, RFK Jr., the Secretary of Health and Human Services, directed for the CDC to remove the claim that vaccines do not cause autism. In an article posted by Politico.com, November 21, 2025, the author, Aaron Pellish, quoted RFK Jr. RFK Jr. stated, "The whole thing about vaccines have been tested and there's been this determination made is just a lie. The phrase, vaccines do not cause autism, is not supported by science." Pellish wrote, that the change on the CDC's website on Wednesday reversed a conclusion drawn from decades of research by vaccine scientists done, in part, to combat misinformation about vaccines and their potential link to autism. Before leading the nation's public health agencies, Kennedy and the anti-vaccine activist groups he worked with were among the leading proponents of vaccine misinformation. With this information being spread throughout news outlets and social media, parents in South Carolina continued to keep their children unvaccinated through November. Because of this, the outbreak continued to pick up into the winter.
If you've ever compared an unvaccinated kid to a vaccinated kid, you see the bright eyes and the engagement and the social interactions and the curiosity and the affection and you compare them. A child even had 1 or 2 vaccines and they're completely different.
2 moms in Spartanburg didn't exactly follow these claims. One mom, Tracy Hobbs, took her 5-year-old twins to one of the mobile vaccination units for measles vaccinations. Although she should have gotten their first MMR vaccinations when they were around 12 months old, she decided against it because her 7-year-old son was diagnosed with autism shortly after getting his measles vaccine.
All 3 of my children are autistic. Yes. What had happened was there was conflicting information about whether the vaccines were causing autism or not. So we were afraid that if we had gotten the kids the vaccines that it might actually cause autism. So, and that's really messed up because what are you supposed to believe? Not get the vaccine at birth, so they got the autism regardless.
After not vaccinating her twins, they were also diagnosed with autism. So she decided to get their measles vaccinations and disregard the voices of other parents. Another mom, Kate Morrow, said that the misinformation about autism is hard to hear. Both of her twins are fully vaccinated, one of which has autism. Morrow aims to encourage parents to trust science and openly speak to pediatricians about their fears. Her strong opinions led her to helping a pro-vaccination organization called South Carolina Families for Vaccines get off the ground. She wants to help the moms who are stuck and struggling and just want to keep their children safe. The outreach efforts of parents and doctors in South Carolina were somewhat successful, as in January 2026, there was a 162% increase in MMR vaccinations as compared to January 2025. As a lot more people were getting vaccinated, numbers of measles cases in South Carolina continued to decrease through the end of April. During the outbreak, the South Carolina Department of Public Health would send out updates of exposure to measles, encouraging people who were exposed to stay quarantined. Case numbers rose to around 990 cases in March of 2026, but the numbers were slowing at around 10 cases per week, compared to the large 200 per week in mid-January. Come April 27, 2026, after a total of around 1,000 cases of measles were reported, the outbreak was declared over.
Thank you for being here. As South Carolina declares an end to the United States' largest measles outbreak in more than 35 years.
The anti versus pro-vaccination debate can be attributed to the 4 principles of biomedical ethics by Beauchamp and Childress. These 4 principles are autonomy, non-maleficence, beneficence, and justice. We can use the principles in the future to spread awareness and encouragement to parents to get their children vaccinated. I'm going to be explaining all 4 principles and the terms in which they can be applied to this debate. The first principle I am touching on is autonomy. Autonomy is the right to be self-governing and the right to make decisions regarding your own body. Autonomy is used as a large argument against vaccine mandates, with many anti-vaxxers using the quote, "my body, my choice." They use this argument to exempt themselves from vaccinations. But choices regarding my body, my choice don't impact others. Therefore, I see this argument as invalid when speaking about vaccines, as the choices for some to not get vaccinated impact the bodies of others and not just themselves. If we use the argument, my body, my choice, in terms of vaccinations, then the argument should be shifted to my body and the bodies of everyone near me and in my community, my choice. With measles specifically, it is a disease that is highly contagious and could heavily impact immunocompromised people or infants who do not yet have the measles vaccinations. Measles destroys immune system memory, so although there have been no deaths recorded from the South Carolina outbreak, those who were infected are at high risk of suffering more than the average person when getting beatable illnesses like the flu. The second principle I am touching on is non-maleficence. Non-maleficence is the act of doing no harm. We can use this principle to the advantage of arguing for vaccinations through proof that vaccines are properly tested before being distributed to the public. When trust is built within communities through proof of this thorough science, parents will be more encouraged and feel safer getting their children vaccinated. The third principle of biomedical ethics, beneficence, is defined as the ethical principle, quality, or act of doing good, being charitable, and acting with kindness to benefit others. The act of doing good was seen throughout my case study. For example, with health officials setting up mobile vaccination units to make vaccines more accessible to community members. The parents setting up South Carolina Families for Vaccines is another example of acting to do good for the benefit of others, as this organization spreads awareness in the community, encourage vaccinations to protect Spartanburg County and South Carolina communities as a whole. The final principle I will be touching on is justice. Justice is the principle of fairness, equity, and moral rightness. This ties directly to the safety of the community. The community as a whole is at risk when someone makes the decision not to get vaccinated. It is unfair and unjust for the decision of others' safety to be in the hands of people who refuse vaccinations based on debunked theories, such as the idea that vaccines cause autism in children. The vaccine mandate, as seen with COVID-19, was seen by the majority as just to keep everyone safe and healthy amidst the global pandemic. Comparing this mandate to the measles outbreak is plausible because the measles are a nasty yet preventable disease spreading through these outbreaks. Reflecting on my research, I want to bring the investigation back to my original question of how are anti-vaccination parents affecting their communities and children, and how is this debate impacting people around the U.S. overall? This question can be answered quite simply. Anti-vax parents are affecting their communities by causing the spread of harmful viruses, for example, the measles, spreading through South Carolina and many other parts of the country. Their children are being impacted as these are the people suffering through the harmful viruses that are preventable through vaccines. My other part of the question has a few different answers. First, the debate is complex and heavily misinformed in today's society, especially with the overbearing use of social media. Around the U.S., people are seeing words from those in positions of power, like RFK Jr., and some parents may be treating these words as gospel and seeing the information as ways to keep their children protected. As I concluded my research on the South Carolina outbreak, I discovered that a very similar scenario is currently happening in Utah, as it took the new title as the center of measles in the U.S. after reaching over 600 cases in April. Children are still suffering from such a preventable disease throughout 37 jurisdictions in the U.S. The CDC updated the current status of measles on May 1st, and in the measles map, it is clear that South Carolina, Utah, Texas, Florida, and Arizona are the 5 states with the largest outbreaks. These are states that are red in elections with many anti-vax conservatives. In the U.S. overall, there have been 3 reported deaths from the measles outbreak: 2 unvaccinated children in Texas and 1 unvaccinated adult in New Mexico.
The measles vaccine is unequivocally safe and effective. Misinformation and disinformation cost us lives.
It is saddening knowing that these deaths were entirely preventable throughout vaccinations. In the future, the 4 principles of biomedical ethics should be clearly spread throughout communities to impede upon the anti-vax mindsets that parents have today. I understand that these parents do believe that they are protecting their kids, and these ideas are often motivated following bad experiences in healthcare, as well as mistrust in medical professionals or religious beliefs. Going forward, I fear for the children and who have been exposed to this disease, and I hope to see updates that these outbreaks are ending and not continuing throughout the U.S.